too many different procedures, and they're all getting mixed up in my head.
Oh, good. We like this.
Yeah, I know, this is great, right?
I did
Yes.
this.
Right? And so, and you have this talus in here, right? This is metal for you. Metal. And so over time, what happened, this failed and you eroded into this part of your joint. Which on your x-rays, I'll pull up in a minute.
So this part
So
here is
this
eroding
part
this
is kind of
part?
gone.
Oh, man.
This is metal. Your heel's out here to the side and kind of articulating with your fibula. You know, because your heel sits underneath like that. And so as this kicked over, it started kind of really rubbing and impinging. That's the pain that you have on the outside.
Okay.
We talked about, right, doing a replacement, right? Can you do a replacement? So can you cut this surface and put in metal here and correct it? And I think, like we said, with your deformity and everything you've had, I think you're at pretty high risk of that not working. It sounds like Dr. Perek thought that was probably
Yes.
the case too. So
Okay.
what we're going to do is we're going to go in the outside, we're going to cut your bone here and take this out.
Okay.
Gives us access to the talus so that we can take this talus bone out
Okay.
and then put in that femoral head, kind of clear out the space here, any residual cartilage, and put the femoral head graft in here.
All right, now talk to me about that.
So that's bone graft from a cadaver.
That was part of one of my questions.
Yeah, dead person. They cut, you know, the femur shaped like this with the. So they kind of give us this whole section of graft from there up, and so we kind of choose the best part of the bone that fits. The most recent one that I did, I took the neck portion because it has thicker bone on each side, and his was not the talus that was gone, it was the tibia, and so we kind of put it in, replicated the tibia.
Okay.
This oftentimes will kind of take this portion and shave a little bit off of these sides because that part of the bone is the cancellous portion. It's like the woven bone that we're trying to get your bone to kind of grow and attach to. And so we put that in there, and then you put a rod that goes up from the heel into the tibia, like that.
So does
Two
that,
screws that are in the heel, and then screws that are in here that compress and squeeze down, because we're trying to get, essentially tell the body that this should all be one bone.
all right,
There
so
to
this, that does not allow it to go this way then, does it?
Correct.
Okay.
Yeah, so the ankle no longer goes up and down.
All right.
You have
Not
a little,
this way either, right?
and no side to side in the hind foot. You have a little bit of up and down through the transverse tarsal joints. I'll show you on this foot, so I'm not torturing
Okay.
the bad one. Tight shoes on. Right, but so your ankle joint is the up and down. Your subtalar joint, this one right here, is the side.
Oh,
to that
okay.
side to side. So that will be fixed, kind of like that. You'll have this. You'll have
Right.
just that little bit of foot motion there. So you get a little bit of kind of flipper motion, right? And because the talus, if you look at your foot from the side, the talus kind of comes down like this, and it articulates with the navicular. Well, when we take your talus, the metal one that you have, out, we don't replace that. So the bone graft goes in here. We just let that joint stay loose, and that's where you kind of keep motion.
Is that the joint we're concerned about with union?
No.
Okay.
That one I don't want to heal because I want it to move. So when we're looking at your ankle from the front and from the side, right? So you will have a graft kind of in here. It's this joint right there between that bone and the metal. That will leave. And you'll kind of have this bone, allograft bone in here. And in here, that is what's bridging the gap, and then a rod that goes up it. It looks kind of like this. Like that. Right? Yes.